We're going to see, as you all have been hearing, continued rise in cases.
The United States again setting COVID-19 records. A U.S. president again trying to reassure the public that the government is responding as Omicron ravages the country. Hello, I'm Arnold Weideman. This is The Heat. On Monday, the United States set another grim coronavirus milestone. More than 1 million new cases reported in a single day. The spike is stark. The Omicron variant is infecting people at alarming rates. President Joe Biden addressed the staggering numbers. CGTN White House correspondent Nathan King has details.
Despite record number of cases of the new Omicron variant, the US president is basically repeating his message from late 2021 that says if you're vaccinated and boosted, essentially you have nothing to worry about. And he says that the 500 million tests that he promised before the Christmas break are on the way. It's a very different message from early in the pandemic. Remember, the US and other nations are going to their third year of this, and he is vowing that this can be managed despite a skeptical population.
We have in hand all the vaccines we need to get every American fully vaccinated, including the booster shot. So there's no excuse for anyone being unvaccinated. This continues to be a pandemic of the unvaccinated.
The problem is that testing is still a big problem, and with kids coming back from the Christmas break and going to school, there are worries from teachers and parents and beyond. Also, all those tens of millions of Americans coming back to work from having seen loved ones. Are we going to see even more cases than the million we saw on the January the 3rd registered? The likelihood is yes. But the silver lining is that even though hospitalizations for children seem to be slightly up, they are generally not reflecting the number of hospitalizations you saw with the Delta variant, considered how many people are getting infected. Deaths also are remaining level or even coming down. But the big test is over the next 2 weeks. In fact, the Biden administration is basically saying we can cope with the virus. Their unstated policy is living essentially with COVID now as we enter the third year of the pandemic. In fact, as you know, before Christmas, they cut the quarantine period for asymptomatic cases from 10 days to 5 days. We've seen shortages of personnel at airlines, hospitals, elsewhere, and that could affect the good economic recovery that we've seen. But the real question is, are there going to be more variants? Is the US prepared to fight it? As we know, the supply chain has been bad, and once again, the US has been caught unprepared when it comes to the number of tests it needs and all the material going forward. But the message from this administration is get vaccinated if you haven't, get boosted if you haven't. Things should be okay. Nathan King, CGTN, at the White House.
There is a lot to discuss. Let's bring in our panelists. From San Francisco, Dr. Peter Chin-Hong is a professor of medicine and an infectious disease specialist at the University of California. Dr. Ziyad Al-Aly is the director of the Clinical Epidemiology Center at the Veteran Affairs St. Louis Healthcare System. He is in St. Louis, Missouri, and here in Washington, D.C., Dr. George Benjamin is the executive director of the American Public Health Association, and Joseph Williams, also here in D.C., is senior managing editor for Color of Change. Thank you, everyone, for being with us. George Benjamin, let me start with you. As we reported on Monday, the United States reported more than 1 million new cases of COVID-19, mostly from the Omicron variant. That's a record anywhere in the world. What does this tell us about the mitigation efforts that are being made by the federal government, by states, to bring the spread of this virus under control?
Yeah, I think it tells us a lot about the this virus, particularly the Omicron variant, and how infectious it is, and the fact that we still have a substantial number of people in the United States that are unvaccinated, and then we have people who are vaccinated who are getting their breakthrough infections because their vaccination is waning a little bit. The good news is that this disease does not yet seem to be as severe as the other variants did, but I'm still worried about it because it could still be a very severe outbreak. And you can see the numbers are devastating.
George, just one question on what you said a moment ago about the fact that we have these breakthrough infections because vaccines or the efficacy of vaccines is waning. Do we have any kind of timeline on when that starts and when we are more vulnerable to getting infected again?
Yeah, we're seeing this about the month 4.5, 5 or so. It seems to go, but I think the thing we have to be very careful is that we're all focusing, which we probably don't need to focus as much on, is on the initial antibody levels. We still have T immunity, and what that means is that, and what we are seeing from the vaccination is that if you're fully vaccinated, and particularly if you're boosted, your risk of getting really sick and dying is extraordinarily low. So the vaccine is doing what it's initially designed to do. It just is not as effective over time at preventing people from getting the disease in the first place, even if they're vaccinated, and sharing that virus with other people.
Ziyad, we have seen in other countries that Omicron, the spread of Omicron, that it's pushed numbers up, then it peaks, then numbers come down. But what is the situation in the United States? I mean, could we see it get a lot worse here?
So this is what we're still seeing now in the US. It's still climbing up, and eventually it will come down. What comes up is eventually will come down. But the real question is that how many lives will be lost in the process, in this peak, and how long will it last in the United States? It's unfortunate that it hit the US, during the holiday season where people are sort of gathering together. There's a lot of chance of transmission, and it's also cold weather. So there's a lot of factors now that are fueling faster and faster transmission, and as pointed out by the by the speaker before me, that it also hit the US when a lot of people are still unvaccinated, and some of the even vaccinated are with waning immunity because they haven't gotten the booster yet. Not everybody has gotten the booster. So multiple factors fueling the surge, and it's really remarkable. It's the highest level of cases that we've seen in the pandemic, and this really should not be happening in 2022 when you have so many vaccines available and we know how to really combat the virus. We know how to really quiet it down. It really should not be happening.
Right, but Ziyad, the situation is still that there are many people, of course, who are infected, but they're not getting seriously ill.
So the jury is still out. I mean, there are initial sort of data suggesting that Omicron may be a bit less serious or milder than Delta. Usually, sort of hospitalization and death, they sort of really are there is a latency period. They sort of like lag behind. So I don't know that we've seen the full toll of Omicron yet. So I still think that it's premature to call it a milder disease than Delta is.
All right, let's go to San Francisco to Peter Chin-Hong. Peter, there's also been a significant number of hospitalizations. I was looking at some numbers which were published in the Washington Post, and it shows that there were more than 100,000 people who were admitted to hospitals. That's on Monday, and that's the highest number since the summer. Would it be fair to assume, Peter, that these are people who were unvaccinated?
Yes. I'm working in the hospital this week, and I would say that still more than 90% of the patients with COVID that I'm taking care of are unvaccinated. So like what President Biden said, this is a disease of the unvaccinated right now that's straining our hospital system.
And what kind of pressure is this putting on healthcare services?
It's putting tremendous pressure because when we look at bed capacity, it's not just the bed that's a measure of if a hospital is up and running. It's the people taking care of the patient. And because so many healthcare workers are ill right now, they may not be severely ill, but they're still taken out of commission for at least 5 days now. That leaves a big hole so that you may have the bed, but if you don't have people to take care of the patient, the respiratory therapists, the nurses, the physicians, then that's not a very effective bed.
And are we still seeing the situation, Peter, like we saw at the beginning of this pandemic, where people are taken to hospital? Many of them actually have to go into the intensive care units. They need oxygen. They need those machines to help them breathe. Is that still the case?
I would say that it's probably a little bit less than that in my sort of experience. If I look at South African data, I think it was compelling that, you know, it's the reverse, where 70% of the people, instead of being in the unit who were hospitalized, were on the floor. They stayed for fewer days, 3 days instead of 7 to 8 days. So I'm crossing my fingers right now. And as Ziyad said, it's a little too early for sure, but I'm hopeful that it's going to mirror what was seen in South Africa, even though South Africa, of course, is not the United States.
Right. Joseph Williams, of course, this has been very politicized, this entire pandemic, right from the beginning. In fact, in the last presidential debate in the run-up to the 2020 election, then candidate Joe Biden, he made some very strong statements about the pandemic. Let's listen to what he said at that time.
220,000 Americans dead. If you hear nothing else I say tonight, hear this. Anyone who's responsible for not taking control, in fact, not saying I take no responsibility initially, anyone who's responsible for that many deaths should not remain as President of the United States of America.
So, Joseph, I mean, back then the number was 220,000. Now, as I just mentioned, it's 1 million a day. Is this also going to be the way in which President Biden is going to be judged on his handling of the pandemic?
Well, if the polls are to be believed, yes, mainly because right now he's underwater. I mean, let's be clear, there are a host of other issues that are dragging down the president's approval numbers, but certainly this is, if it's not at the top of the list, it's definitely near the top. Because if you take stock, if you step back, and even discounting the fact that he said anyone who says you're not responsible, that was almost 600,000 deaths ago. We're now tracking in on 850,000 deaths. So that alone, in terms of numbers, it seems that he would have to bear some responsibility. But if you pull back and look at the larger picture, you've got an economy that's disarrayed that you can blame on COVID. You've got political governors. You've got political turmoil happening because you have Republican governors feuding with a Democratic White House about who's responsible and about what to do to ease this burden. You've got schools that are still in disarray, despite the fact that the schools are largely remaining open. You have almost 2,000 schools across the country that are closed, and some more that are considering closing or taking time off or doing virtual learning, which poses yet another headache for parents who are trying to figure out another way to juggle taking care of their children, doing their job, and doing it remotely while the kids are learning remotely. So it's all pretty much a bad news scenario for President Biden at this moment. The good news is provided by the doctors that have just spoken, the fact that this appears to be a milder form of the variant, although it's very sticky and very commutable. But it also appears that the spike, we're on the ascent of the spike, but the descent could be nearly as quickly as the rise.
Joseph, we have talked about this before. You know, there are, of course, 50 states in the United States, and so we're getting something like 50 different responses to this pandemic. Is there any way to sort of get a federal response, one response to the virus, if these numbers keep going up?
If you're Joe Biden, no, because the people who are most suspicious and most resistant to taking common sense public health advice are people who are opposed to the White House. We have indeed talked about this maybe 3 or 4 months ago. This was a red state pandemic. Now it's everywhere. DC, Chicago, blue states, everybody's struggling with this new Omicron variant because it is so contagious. So I think by and large, the best thing that Biden is doing is what he's doing now, politically speaking anyway, is to make strong suggestions, assert that the only way out of this is to get vaccinated and boosted, and warn people that even if it is a milder variant of a very dangerous disease, you will still be way safer than you would be unvaccinated, and you're less likely to be hospitalized and die if you are vaccinated.
Ziyad, I want to get back to something Joseph mentioned a moment ago, and that is the Omicron variant. It is responsible, according to the numbers we've been looking at, for about 95% of the infections last week. So do we presume then that this is now the dominant variant? And what about the previous variant, Delta? What has happened to that?
So it overtook Delta. So it's very clear now in the US that Omicron is the dominant variant. And that's what viruses do. Viruses mutate and take over each other. So Delta was dominant before, but clearly now sort of it had overtaken by Omicron. The challenge with Omicron is that it's really highly transmissible and it's really spreading like wildfire, as pointed out by the previous speakers. It's everywhere in the US and arguably also everywhere in the world, except certain pockets.
George Benjamin, there was a theory being floated around, and I first saw it about a week ago, and that theory goes something like this, that Omicron, with its weaker symptoms, is actually good news. It means that the virus is transitioning to the equivalent, in one instance I heard this, of what we know as the cold virus. It will spread, but we do have the means to treat it and bring it under control. What do you make of that theory?
I think that's one possible future, but that depends on us not getting another variant that is much more pathogenic and as infectious as the Omicron variant. But that's a possibility here, and it's a possibility that it'll just quote unquote burn itself out. In other words, it'll be endemic, it'll be around, but people will get it, and we will. If you're vaccinated, you'll do fine. If you're unvaccinated, you'll still not do very well, as we're seeing right now. But that is one possible future.
Peter, what are your thoughts on that theory? The Wall Street Journal, in fact, ran a piece in which it makes the case that Omicron is actually a blessing in disguise, as it called it. High infection rates, but low mortality risk. And it will also help humans develop antibodies against other variants, which could be coming down the pipeline, which could possibly help herd immunity. What do you make of it?
Well, Anand, if Omicron was going to be the only variant that we have in perpetuity, then that would be a fair outcome and a rosy outcome. But again, like George said, we don't know what the next variant is. And if you think about natural selection, maybe the next variant would be vaccine resistant. Maybe the next variant will be even more transmissible. Maybe it will cause more severe disease. I guess it's just a question of a box. And, probably the only reassurance that I would have is if you get vaccinated, because again, as the other speakers pointed out, our adaptive immunity would take care of keeping you away from the hospital. And again, it's really important to separate those dramatic 5,000% increases in Puerto Rico, 1,000% increase in Washington, D.C., with hospital capacity. And I think that's kind of where it goes. Whether or not we'll stay with Omicron or we'll get a new variant, that'll be the new Omicron, and we won't be we'll be susceptible to it all over again, will be the question.
So you say there is a possibility, Peter, that we could get a variant that is resistant to vaccines. Does that mean that sort of pharmaceutical companies continue to research vaccines all the time?
That's a possibility. I think, for many scientists believe that, regardless of what variant you get, that if you have the original vaccine series, that it will morph to whatever, or, the T cells and B cells, memory cells will be able to address the new variant in town. It's just that the mayhem it causes in society would probably not be, unavoidable unless we change our thinking about what an infection is and what it means to have an infection versus right now, we're trying to contain or keep the sick people away from the not sick people, but you don't do that with colds per se, and you don't even do that with influenza, although maybe we should.
Joseph Williams, let's talk about schools and children going back to school. Of course, it's the beginning of a new term right now after the holidays. And during that briefing at the White House on Tuesday, President Biden defended his decision. He says he's going to keep schools open. And that's despite some concerns that have been expressed by both parents and teachers. In fact, there have been some reports that some teachers are even threatening a walkout. What are the political risks for the president in this?
Quite high. I mean, he's not in a very good situation here. The Chicago schools teachers, they're about to vote whether or not they want to walk out and have a remote learning situation because they're afraid of catching COVID. So teachers who I know who I know here in the Washington, D.C. area feel essentially the same way. They're vaccinated, but you see breakthrough infections. And that has to be concerning, particularly if teachers have an underlying health issue that could cause a breakthrough infection to be almost as bad as getting COVID without any kind of vaccination. So they're very definitely worried, and arguably legitimately so. But you balance that again against parents who are stressed out, who are trying to work remotely, and who are trying to figure out how to handle children at home in the midst of all this. There have been a couple of different strategies that have been floated, including one where if you have a child who tested positive, that you isolate that child rather than isolate the entire classroom and enable people to keep going. You have a vaccine approval for children 5 and older, which could help mitigate the situation. But again, if you're a parent, it can be very, very confusing, almost to the point of overwhelming. So this is yet another political danger that the president has to navigate, particularly as Republicans are eyeing suburban parents who are quite frustrated about this. In neighboring Virginia, you'll recall there was an election that almost hinged on parent anger in Northern Virginia, where Glenn Youngkin, the Republican in a state that had been trending blue, won the Republican nomination and won the presidency, or rather the governorship of Virginia, on the backs of, or on the tide of anger from parents who are frustrated about school closures, among other things. So it's a pretty risky strategy, but on the whole, he is standing with not only relatively new science that says it should be okay for schools to remain open, but also with his infectious disease specialist, Dr. Fauci, who is talking about mitigating the risk of keeping children at home, mitigating the learning loss and the social problems of having a child have a remote school education for yet another year against the risk of getting teachers vaccinated and kids coming home with an infection or bringing the infection from home to the classroom.
Ziyad, what do you think? Is it safe for children to go back to school?
Well, it's a really hard call. It's really sort of depends on the situation in the city or the county where the kids live, and also whether the school is sort of instituting or installing mitigation measures, and also the age of the kids. So kids who are vaccinated now, let's say 10-year-old kid, who have they're somewhat protected, and if the school, depending on what the state and the locality is, allows for masking or encourages masking or mandates masking, that's probably a different situation where different than schools where kids are totally unvaccinated, teachers are unvaccinated, or low rates of vaccination and no masking. So it should be really individualized. And what we've learned from the pandemic is really sort of there's no one situation or one sort of a size that fits all.
George Benjamin, one other development, the FDA has authorized booster shots for teenagers. Those are teenagers aged between 12 and 15. It is pending CDC approval, and the FDA has also shortened the period between the second and third doses. What kind of impact will this have?
No, I think the CDC actually just recently signed off on that. May have been earlier today or not, but yeah, it's going to be good, because it means that we'll have authorization to vaccinate more kids. The more we get these kids vaccinated, the faster we can get them back out and engaged in society. And going to school is very, very important, and getting vaccinated is a very important part of that.
Peter, there's also another big debate going on, and that is the fact that the CDC has cut the quarantine time from 10 days to 5 days for people who test positive. And it sort of illustrates the pressure that authorities are facing between keeping the economy open on the one hand and keeping people safe on the other. Do you think 5 days is a safe enough time?
I think 5 days is a safe enough time for most people, but not all. And the question is, who are these people who might still be transmissible? And are they going to wear a good quality mask out and about in public for those remaining 5 days? I think California was nervous, and they said to exit those 5 days, you have to have a negative test. The CDC pushed back today saying you don't need that negative test to exit. So I think there's a lot of confusion. I think healthcare professionals are generally in support of getting a test to exit. Certainly in the healthcare field, you wouldn't want to necessarily take care of a patient if you're one of the 13% of people who may still be transmissible at day 5.
So then, Peter, what that means is that the CDC is pretty confident that if you test positive, they're confident that after 5 days, you would not be a carrier of this virus any longer.
Yes, I mean, Dr. Walensky and the CDC says there's some data which hasn't been made public that with Omicron, after day 5, your chances of transmission is very, very low. And it may be true. We know that Omicron is probably faster in the upswing for the incubation time and for what we call the generation time time from incubation to transmission. But again, we haven't really seen or peer reviewed that data, but maybe we don't have enough time, and this is kind of a stopgap measure to kind of keep the economy going.
Joseph, here we see, as I mentioned, the intersection of the economy and public health. And if we look at some of the things that happened on Monday, 3,000 flights were cancelled. Of course, a lot of that had to do with the weather here in the East, but a lot of it because of COVID and how it's affected staffing levels for airlines. Pilots and crew have been affected. In fact, some unions say that the change in the quarantine period from 10 days to 5 days was driven by business concern. In fact, there have been reports that the chairman of one airline actually called the CDC and asked for that reduced quarantine time. So is what we're seeing here a battle between, the health of the people and the health of the economy?
Well, we've said it before, they go almost hand in hand, especially during the middle of a pandemic. And it's not just airlines. You look from the NFL to stores, from your local restaurant that has to close on Mondays because too many staffers are afraid to come to work, or you have an outbreak at a certain level of employment, to your own personal situation where you may have to work from home and work that people don't want to do. We talk about the unemployment rate that is low, but we still have a lot of jobs that are not being filled. So this is one of the most unusual times I would venture to say most any economist has ever seen. And certainly you have this balance. And you mentioned the call from, I believe it was Delta Airlines to the White House talking about the minimum quarantine time. You also have a president that has refused, against some health recommendations, to require vaccine mandates for airline flights, unlike the flight restrictions coming in. You had to, if you're traveling from overseas to the United States, you would have to show proof positive of a vaccination or of a negative test. You don't have that flying domestically, which some would point to as a reason why this virus refuses to go away, because we have not united as a country behind what needs to happen in order to make it go away. And as always, the virus is going to get the last word. We can only do our part to try to mitigate it.
George, very quickly, I've got less than a minute left. We've been hearing about the pill to treat COVID, George. President Biden has been talking about it. What do we know about the pill and possible side effects?
We know that they can be pretty good, but they do have some complications, and that there are some medication interactions we need to be concerned about. The biggest problem right now is we just don't have enough of them.
Okay, that's where we have to leave it. Thanks to all of you for a great discussion. That is it for this edition of The Heat. I'm Anand Naidu in Washington, D.C. Thanks for watching.